Basal cell carcinoma is a primary malignancy of the skin, and it's a tumor that it arises from the basal cell layer of the skin. It tends to be well circumscribed. It has rolled up edges, tends to be red, doesn't tend to hurt, and it can occur on any skin surface. It mostly affects people who have had chronic sun exposure. So it tends to affect older people. It tends to occur on sun-exposed areas, but they can occur in any part of the skin. Early detection is very important because these tumors tend to grow slowly, but they can also infiltrate into the skin and get quite large. So the bigger they become, the more difficult it is to remove. The main way of treating is with surgery. They're simply excised. Sometimes they are too big to be excised, or they're in areas of the skin, such as the face, which doing surgery would cause disfigurement. And radiotherapy, it can be very effective at controlling them instead of surgery. Some of these basal cells get very big, and they can also become resistant to radiation. In that case, there's a new class of agent called so-called hedgehog inhibitors, which are targeted agents which can basically arrest the growth of these tumors and cause them to shrink. There's a drug that has been developed primarily in the States called vismodegib, and this is one of these hedgehog inhibitors and has been very effective at shrinking down these large basal cell carcinomas. In Canada, it's not yet approved, and so we do have a program for patients to have access to it should they need it, but we're hoping that it'll be more widely available for these patients to use. There are other so-called hedgehog inhibitors which are being developed and are in clinical trials, and they may prove to be even more effective.